Um, the reason why we're doing this lecture today is because we're all sitting inside our houses for 3 weeks, listening so many information from the news. I think it's very important that we get some information of what is going on with East Asian medicine in this situation. Um, I'm going to say some things which is not out of my personal observation. So this is making it a little bit hard for me. So I have been gathering information from different references. For example, the World Federation of Acupuncture Societies. If you, by the way, if you go into the notes that I've given you in the Facebook page, at the end there are the references. So if you want to read more, you can go there, type the reference on the internet, and you can read the whole article. So basically, I've been reading articles from places which I think they are accredited, and I've been also talking with some of the doctors here in Greece because they have this Facebook group, and also with some of the doctors in China. And I've I've been a little bit puzzled of what is going on because I personally I haven't seen any case. So I'm just gonna talk. I'm just gonna talk out of my understanding from other people. So it is making it quite difficult, and I'm still puzzled. But it's not only that. This is the in China. If you want to talk about one specific issue, uh, mm, there is a big chance that you're gonna listen to different of opinions, and this is the same with this coronavirus disease. By the way, this is COVID-19. It's a disease. So for example, you take the pulse, and then you listen to the different professors, and everyone can say something different. Um, and this is the difference between East Asian medicine and conventional medicine. In conventional medicine, what we're trying to do now is that there is one kind of diagnose, and then there is, or at least they're trying to have, a specific type of treatment, and that's it. Very straightforward, very simple, very logical. In Chinese medicine, it is the same, but at the same time not. One thing that kind of perplexes things is that we see the diagnosis and we see the pathogen also according to the tools that we have as a treatment. So, for example, you will see the notes that I have. If you are doing herbal medicine, then you have more tools, so it's much easier that you kind of break it down into more uh, subtle things. Acupuncture is a little bit it's a little bit more general, let's put it like this. So if you read the notes from the government, because the government now they are giving some advices for herbal prescription, and if you see, um, for example, World Federation of Acupuncture Societies guidelines, you will see some contradictory things. So it's a debate. So I'm going to start describing you a little bit of what is this disease, and another reason why it's complicated is because we're talking about one disease, but it's in different stages. That's making it also more complicated. So maybe somebody's writing for, you know, a stage which is very serious. Maybe somebody else writes for a stage which is less serious. So you have different kind of things to say for each stage. That's another thing. And finally, another reason why it is difficult, the whole thing, is because you also have the underlying things of each patient, which can kind of affect your diagnosis. Because what we do is we see individual cases, and then we kind of sum it up and we try to figure out what is going on. The thing is that we have groups of people with underlying things. We've said that people that they go to hospitals and they are much more likely to be seen by doctors, they have these underlying health issues that it could be the same. You know, they have diabetes mellitus. Even people with diabetes mellitus in East Asian medicine, that is divided into some categories. Yeah. So that's all to make you understand why you will get different kind of information, and this is also what I encountered in my seek to understand what is going on. So let's start. You know, I want to start, always want to try to break it down into simple things. And first of all, I'm going to say what is common and what is straightforward, and then we're going to see this different experts' opinion into this coronavirus disease. So we know that we have different kind of cases. The less mild is the case that, you know, you contract the virus, but you have no symptom whatsoever. Yeah, you could be having that, and nobody knows that you have it. And this is the problem now, and this is why actually we should all wear masks.
Yanni, you said the less mild. I think you mean the mildest, no?
The mildest, yeah, sorry.
Okay.
Let's put it like very light cases, yeah? For example, you know, this is the problem with the kids. I explained you the previous time why you could have um, very young people also having that disease and even dying from it. I've talked to you about the 5% that it will be out of this normal curve. But in most of the cases, if you have a young kid, he will be a carrier, but he will not suffer out of this disease. Nobody will know about it. And you know, if you see WHO, the World Health Organization, now is asking for the ones that they have the disease to wear the mask, and this is because this virus is transmitted mainly through our nasal discharge, saliva, etc. So all these droplets, for example, when you cough, sneeze, or even when you talk. So actually, why we should all be wearing it? Because even for example, those kids, even if they have it, nobody will know. Yeah. WHO says that only the people with disease should wear the mask. The reason is because we will not be having enough masks if everybody is wearing. Yeah. Now you will see that all the factories, they are switching into building incubation machines or creating masks, etc. So that's why actually we should all be wearing, no matter what WHO says. Anyway, my point is that we could be having that and we have no symptom. Yeah. The cool thing with East Asian medicine is that if you see patients then you know that there is this incubation time, that patient has no symptoms, but actually there are changes happening into his body. And actually you can feel that. I haven't felt it, but since it is a little bit common, it is a little bit like a common cold. We know that if you get a common cold, maybe you don't know it, but through the pulse you can feel it. Usually the tune of the right hand, which is related with the lung, usually is becoming a little bit more floating, more full. Yeah. Why is that? Because the chi and the blood is moving there to fight with the virus. Yeah. So in this very light stage, there are no symptoms. Yeah. And the we as doctors we could see that, or at least we could be thinking about it if we feel the pulse. Now we also have this is the next stage, which is something similar as a common cold. So what can we see from this stage? We can see that no matter what it is an external pathogen, because we have people talking about different kind of pathogens. Yeah, we'll talk about it later. So in this common cold-like syndrome, you will have all kind of common cold symptoms, which could be very mild, yeah, or it could be very, you know, very severe. And this is what I've heard, and this is the problem. I can only talk out of what I've heard. You know, people describing it being more severe than having a common cold or an influenza. Yeah, so you have more acute. But actually, no matter what I've heard, we know that different people, according to their immune system or according to their Veichi, they will be having uh, different types of syndromes. It could be more or it could be less. Yeah. So all of those, of course, they will not go to the hospital. They will stay at home. And this is why we have this quarantine thing, because of people having this kind of thing, which is about actually the 80%. Yeah, 80% will be like this. And then we have this other 20%, which will develop more serious stuff. So we have this, we can call it mild, mild cases. Yeah. Those mild cases, they will be having symptoms, and we call it mild, but actually, it's they will be having fever, um, all kind of respiratory symptoms, and that could also impair their breathing ability. Yeah. So that's why these people, they need to go to the hospital. Yeah. Again, now we're trying to categorize everyone, but actually, it's let's put it like this: it's people that they go to the hospital, but they are not dying. Yeah, we've seen people going to the hospital, but they are progressing. Their progression is fine. They do have some symptoms, which is much more serious, but they don't need to be incubated. Let's put it like this. Yeah, and then there are very serious cases that they need to have this ventilation, the support. And I was reading that there is a big percentage after they've put them into the, the mechanical support, the ventilation support, that there is a big percentage of them dying. So that's a way to categorize it and to understand what it is. So you see now, if you try to say something about this coronavirus and you read the articles, you don't know about which stage they're talking about. Yeah, they're starting to talk about this and that, but you have no idea of what is going on there. Yeah. So the nature of disease. Again, I want to talk of what it makes sense for me, and then I'm just going to give you different variations. So I think the key external pathogen in this thing, everybody's mentioning dampness. Yeah. What do we know about dampness? We know that it is an external pathogen. It's an external T, by the way, and it can become pathogen. And we also know that we can produce internal dampness. But in this case, we're not talking about internal dampness, we're talking about an external pathogen. Yeah. So this is something which we can be 100% sure. Then what we've said the previous time is that this thing started at December in China. So what kind of tea did we have at that time? We had cold tea, and we also had dampness. You remember, because we had this excess of earth, which was 2019, and then we were coming into excess of lung. Sorry, we had a deficient earth, and we are coming into an excess of lung, of metal. Yeah. So, and at that time we had a lot of dampness, cold in that area. So, uh, understanding the chi of the environment is also playing an important role into understanding the disease. So, number one, we have damp, and then we have cold. Then it depends of how you see it. Usually, what they describe is that this pathogen, it enters the body, and as we said before, if it's in mild case, nothing happens. Yeah, it just finishes. But if it stays more, then there are different system that is affected, and you could have also changing of the pathogens. So we haven't talked about diagnosing with 6 stages and 4 stages. So I'm not going to go very much deep into it, but I'm just going to scratch the surface a little bit. So this is another place where we have a debate. There are people saying that this kind of external pathogen is following these 6 stages pathology, and this is why also the treatment which is given by some, you will see in my notes I have different kind of treatments. You will see the treatment which is given by some, it is following the way of the Sanhalun, yeah, which is, first of all, you have a Tai Yang syndrome, which is basically something like a common cold. And then you could have Yang Ming and Shao Yang, and then you have the 3 yins. And it goes stage by stage. Uh, Now, there are some other scholars that they say that actually this is not true, because in Sanhalun, we also have some kind of, we have some chapters which they call, which they are talking about the Hebing. He means to merge, and Bing is like a disease, or Liang Gan, like Liang is two, and Gan is, uh, I don't know how to translate it. So it's like two things merging together. And actually, we're not talking about only one syndrome, we're talking about two syndromes at the same time. And of course, when you come into herbal medicine, every kind of stage, or even if it's this more complicated things like Liangan or Hebing, then we need to have different kind of formulas. So the treatment, let's say it's Yang Ming syndrome, it's the treatment is going to be completely different with with a combination of, uh, of two different stages. And this is the reason why when you read different articles, you will see that in some articles, they just give a plain formula. In some other, they just give more complicated formulas, which is actually the combination of the stages that they are affected. Yeah. But what is common into this different system of diagnosis and to those different scholars, the common thing is that we're talking about an external pathogen, which is, so I'm just gonna change my, we're talking about an external pathogen which is invading the body. And from my understanding and what we said the previous time, we've said this, I remind you this famous sentence about Zheng Qi Chu Nei Xie Bu Ke Gan. Like, you know, you have this strong qi inside, the pathogenic qi, it cannot invade. So it is invading, and if you are depleted, if you have these underlying things, it can go very fast. It can affect different kind of stages. This is my understanding. If you have strong qi, then it can stop in a fairly early stage, or even if it goes inside. You know, if you try to and you kind of recuperate, you can overcome this. So this is what I understand. Now, in the process of going inside this pathogen, it turns into heat. From the other hand, we have some scholars talking about Wen Yi, like there is this special kind of term for um, infectious disease and heat, um, which should not be present in a particular time. If you have heat, then that is one of the causes. So we have this debate. Um, the So we do have presence of heat. Uh, I'm not sure if this heat sometimes is coming from outside because of what I just said, you know, for heat which is in a period of time that should not be there, or if it's heat because of cold and damp turned into heat. Yeah. I haven't figured this out. I'm still kind of researching on it. I'm talking with colleagues. I don't know, Ben, you're here. If anyone have read anything or heard anything, I'm open into conversation. Anyway, apart from the dampness and the cold, dampness is 100%, cold, it's debatable, but it seems that there is cold. We have the heat. As I said, it could be either from outside or from transformation of cold into heat. Um, and of course, when we have the heat inside, we will be having also the related syndromes. Another important thing about this disease is the presence of phlegm. Phlegm, as we know, it can be visible or non-visible. The thing with this virus is that what I've heard from most cases is that uh, they have little sputum or dry cough or no phlegm coming out at all. So my understanding is that this is we do have the presence of phlegm, which is in a more progressed stage. Because we know in order to create phlegm is created in upper, middle, or lower jiao because um, of the impaired transportation and transformation of fluids, of body fluids. Yeah. So we do have that, and my understanding is that it is a little bit more progressed when we do have that. And I've been listening to some conversation, as I said before with medical doctors, and they say that what is going on actually is that our immune system is creating a lot of cytokines and a lot of is creating a very big uh, immune response, and that is actually causing a big problem to our body and to our lungs. And how do they see that? Here I have a CT, computer tomography of. There are some other that they are much worse, but this was free in the internet, so it had no rights. So I just copied that, and we can see some places that we have this presence of phlegm. So actually, if we see that thing Western medicine wise, we have the alveoli, and the immune cells is coming there to fight the virus. Yeah, so that is causing inflammation, and that inflammation is creating mucus, is creating extracellular fluid. So all that mucus, extracellular fluid, and it's described very thick. They've seen that into cadavers. They see that in CTs, of course. So this is what we would call in East Asian medicine, what we would call phlegm. And this phlegm, as I said, is non-visible because most of the patients, from what I've heard again, I could be wrong because I have limited access into cases, but most of the people, they describe a dry cough without spitting sputum. And it makes sense. It makes sense. So phlegm is also an important component of this pathology. And I'm just going to note something here. You know, as we said in the previous lecture, um, in this kind of period of times, also in the past, they would create these big pots of herbs, and everybody would drink the same because they would give the same kind of of they would develop the same kind of symptoms. The thing is that even in East Asian places, they did that because I suppose, I'm not sure. I suppose that they did that because it was, you know, more easy for them to do that, and it was faster. Yeah. But if we are able to do our individualized medicine as we know it, then I'm sure that we will be having better results. And this is why I'm analyzing here, because you will be reading my notes and you will see the treatment strategies, and you might think, okay, let me try something. But actually, and this is the problem with people here in Greece, because also in I've heard that there is there is, and even to myself, there is a lot of buzz going on about herbs, etc. People, they're reading strategies and they're just going out of that. We have to stick on to our individualized medicine. And this is why I'm analyzing it, because if we understand what's going on, then we will kind of tailor it up into our patient's case. Of course, there are different categories, but we should be able to do exactly what we need to do. Yeah, and this goes more with the herbs. In a little while, I will talk about acupuncture. So that's the phlegm. And here, one of you shared that from a website in China. So my internet connection is unstable. Can you see me? Can you hear me? Yeah. Okay.
Yes.
Okay. Good. So they were quite a few different tongues, and
So good.
sorry. Hi. Christina, if you are the super host, do you think you can change it, because I can only see two people? Anyway, um, so there are quite a few different tongues, but there is like a similar pattern, yeah. And we know that this is affecting. When we come into more simple way of thinking, we know that this kind of disease is affecting the lung, but we know that it is affecting also the spleen. So people here, you will see that they have, they could be having an enlarged tongue, or they could be having teeth marks. You see this coating, which could be thick or less thick, but you can see the dampness there. For example, in the woman, you can see a little bit more presence of heat. In the upper GI, you can see less coating, more presence of heat coming from the inside. In both cases, you can see the damp and the heat, and you see they are breathing oxygen. So it's I understand that they're hospitalized. So we're talking about a little bit more progressed cases. Of course, there are more severe cases that you will see the coating becoming even thicker and losing its root, because after getting seriously ill, your TM blood is affected. So also the tone is changing. So I would say that this is, for me, this is a typical intermediate stage. So it is severe, but it's not deadly severe. And of course, we could be having lighter cases, which I don't have here, that they are with, of course, different tongue. And I was talking before about this very severe stage. So going into, oh yeah, okay, let's talk a little bit also about the pulse. In the first stage, we suppose, because I have not felt, but what I've read and what I've seen from other colleagues is that they talk about more superficial pulse, because we have this external pathogen affecting the exterior. So the pulse should be more superficial. And we do have presence of slippery qualities, which is related with damp. So I think this is the main thing for the first stage. So for more severe stages, it depends on what we have inside, yeah? So we can have heat or even more heat. So the pulse will be turning kind of fast. And of course, the slippery factor will be present also in the intermediate and severe stage. And in really severe stages, we could have thin, because the blood is at the last, we have the yin affected, the blood is affected. So the pulses will be becoming deep, um, uh, could be fast because if they have high fever. Actually, what is going on is we have this depletion of qi and blood, so that could be present in the pulse. And what we know from other serious cases is that sometimes it can be also kind of like hollow. So it can feel very tight, very, very big pulse, but it's like a straw. So this is also a possibility. I'm going to stop talking about the pulse because, the tongue, at least I can see some pictures, but with the pulse, I can just speculate. So about the treatment principle, as I said before, different opinions. China tried to kind of stop this from happening in East Asian medicine, which is like everybody says his own opinion. And they've basically, what I understood is that they've kind of followed the Sanhalun way of thinking. But from the other hand, in acupuncture, they are giving different kind of treatment protocols, which doesn't go 100% with herbs. So confusing. Anyway, in the stage of, there is this stage that you could be sick or not. So they give this Qing Fei Pai Du Tang. Qing Fei is like clearing the lung. Pai Du means expelling the toxins. By the way, you will be listening about toxins, which is actually more severe things going on. Yeah, it's not a regular pathogen; it's toxic. It means it can move in a different way. It can be more severe. It can create, of course, this turbits, this as phlegm, for example. So this is Qing Fei Pai Du is a very common used formula. Another formula, I'm just gonna verbally talk about it. This you can check my notes in Facebook, into East Asian Medicine Facebook page. Another interesting formula, which I've personally taken it also myself, is the Hoxiang Zheng Qi. And you can, in China, you can take that um, as a tincture. So basically, they have the formula into alcohol. It tastes really bad, but anyway. And or you can drink this Hoxiang Zheng Qiwan, or this we call it xiaoliu, which is like small droplets or small pills. This is easy to take. So this is for the first stages. And why have I taken it in? I remember I took it. I've taken it, and I also give it when it's summertime because you have this damp heat going on. So from that you understand that there is damp. Uh, uh, there is this damp pathogen, which is very important. And into more severe stages that you have fever. Here you have different components, but what I've seen that is the same is the Baihutang, which is clearing the heat because of, as I described before, you have this fever and transformation of heat inside. And then for more severe states, but for even for recuperating, you try to tonify. So you could have something like Sinitang prescribed. I know that you don't know about herbs, but since you are staying at home for 3 weeks, you could be, having some kind of read about this whole matter. And herbs, by the way, are, according to my viewpoint, they are the most important tool that we have from East Asian medicine for this situation. I'm not saying that acupuncture, qigong, cupping, uh, all kind of modalities, they are very, very important. But in its case, um, you should choose your tool. Yeah. And especially for severe cases, I would definitely go for herbs. Yeah. Of course, the combination of tools would be the best, but in this kind of cases, this is the time that you need to combine Western medicine with East Asian medicine. And when you use East Asian medicine, you need to use herbs in severe cases. If there are more light cases, sure, you could have your qigong and acupuncture, but in severe cases, you should 100% be having herbs. Now, what about acupuncture? As I said before, the World Federation of Acupuncture Societies also tried to limit this different experts' opinion and divided this whole situation into 3 stages. So we have this in the first place, we have these suspected cases. I'm just going to be reading you from the inside. I don't want to make any mistake. So acupuncture and moxibustion intervention during the phase of medical observation, suspected cases. I'm not gonna go into the points because you guys still don't know about points. I'm gonna talk a little bit about points when it comes into self-treatment, preservation, etc. So we're gonna talk about that. So the objective, according to WFAS, is to stimulate the vital qi and the functions of lung and the spleen. So again, I didn't talk about that, but also in the herbal way of thinking, we do not have only the lung which is affected, we do also have the Tai Yin and the Yang Ming, so basically the gastrointestinal tract. And we know that because this, the patients that do express symptoms from the gastrointestinal tract. So yes, we do talk about mainly lung problems, but it is also a problem of spleen. So this is why here it mentions to stimulate the vital qi and the functions of lung and spleen, and to dispel, separate, and remove pathogens of pestilence. Yeah. So here you see remove pathogens. So we talk about external pathogens and pestilence, could be toxins, and enhance the defense of viscera against the pathogens. Yeah. So this is the first intervention according to WFAS. Then we have the second stage, which are the confirmed cases. We have the objective, which is to stimulate again the vital qi of the lung and the spleen, to protect the viscera, reduce damage. Yeah, because reduce damage, as I said before, it seems that the immune system is kind of overacting into, while doing that, is kind of damaging itself. The patients, because of the inflammation in the lungs, they have difficulty in breathing. Yeah. So we want to prevent this, the damage to the viscera, not only from the external pathogens, but also out of the immune system overworking, to dispel and preserve, to dispel the perverse of pathogens, and to reinforce the earth to generate metal gold, to stop the tendency of the disease, lighten the mood, enhance the confidence to overcome the disease. So here it also mentions what we've mentioned before in our previous lecture, that it is very important of how we are emotionally and spiritually. Basically, the objective is the same, which is support the qi of the spleen and the lung, and then stop the disease from becoming more severe. Yeah. And then WFAS is talking about acupuncture moxibustion intervention during convalescence, which is basically you have recovered, but there are still things going on. So here the objective is to remove the residual virus, restore vitality, repair function of viscera such as lung and spleen. So this is the understanding. And now I'm going to talk about what WFAS says to us, and what you can do and what you can suggest to your family member, to your friends. You can suggest them to do that as prevention. So to help prevent and control the epidemic, there are some things we can do. One of the things is moxibustion therapy. So wait a second, I'm gonna, in case you don't know what it is, I'm gonna show you. So you can have one of those moxibustion cigars. You can light it up, and you can do self-moxibustion into stomach 36. I suppose that most of you guys already bought some of the acupuncture atlas, etc. So you can go ahead and try to find it. So you do moxibustion into stomach 36, pericardium 6, so Zusanline 1, Hegu, which is large intestine 4, Chi which is on the tummy, Guan Yuan again on the tummy, Shan Jiao, the spleen 6, and each moxibustion would take about 10 minutes. I'm gonna briefly talk about the points so that you can understand why we should use it. So if I would have to pick one, it would be the first, which is the Jusan Li, the stomach 36. There are so many research about that point in China. We know that it works, and later on, after I stop speaking about the treatment principle, I'm going to talk a little bit about the science out of that is backing us up as practitioners of East Asian medicine. So Zhusan Li is one of the most known points because it stimulates the qi. And if we talk about it into conventional medicine point of view, it is stimulating immunity. From East Asian medicine point of view, it is making strong your Zhen Qi, and your upright Qi, and your Wei Qi, your defensive Qi. So that would be number one for me. Number two would be Qihai and Guan Yuan, which is very close. Yeah, one is 1.5, another one is 3 tuns. So it's basically the area below the umbilicus, which are, from Guan Yuan. If you know Chinese, you know that this is the opening and the closing of the Yuan Qi. So Yuan Qi is the Qi which is stored there. So we need to stimulate that. And with moxibustion, we can, we put warmth. Warmth is yang, is activating. So in both cases, we're stimulating qi, which would have an impact on immunity. And then we have the other points. For example, the Hegu point, which is good for expelling pathogens. It is externally related with lung. So, by working on this large intestine and stomach meridian, which they are yang min, by the internal external relationship, we also working on the Tai Yin level. And acupuncture wise, these are, as I said before, these are the main places where the disease is. So mainly it's a Tai Yin Yang Ming pattern. So we have all these organs involved.
May I have a question?
Sure. Let me finish a little bit, and let me finish, and then we'll go into conversation. Okay. Mm-hmm. So you could also do a meridian massage. It says use methods like kneading, pressing, rubbing, tapping, patting on the lung and heart meridian of upper limb, spleen, stomach meridian, 15-20 minutes for each operation. Yeah. So that's from WFAS, self-preservation. So, you know, you could be patting your front move points, and you could be patting along the channels. Patting is a very important thing. If you live in China, you will see everybody doing this in the morning and in the night. Why they're doing that? Many reasons. Uh, One of the most important is that the pathogens that are coming inside our from the exterior. So if you pat, actually you're expelling the pathogens. You're not allowing the pathogens going from the acupoints, from the most delicate meridians running all over our body. You don't allow them to enter into a deeper level. So you are kind of activating the exterior and you are expelling the pathogens. So that will be my number one technique for preservation. If you have symptoms, patting would be also good, but I would go into more specific point pressing. Yeah. And for you guys, you still don't know the points, but self-pressing on back shoe points, front move points, I think is the best choice. It's very straightforward. You just go into the front move points of the lung, you know, front move points of stomach, large intestine, whatever. You can do this everything on the thorax and to the abdomen, and it's going to be fine. In the previous lecture, I've talked about other ways of preservation and how important it is that we stay active, for our VHC to be active, and stay emotional and um, having a quiet mind, because there are so many information coming from the news, which are exaggerated. Of course, it is a big issue, but it is also exaggerated. And you know, all this information coming inside, it is affecting our sen. So it's up to us if we're gonna let it affect us a lot or not. And for the end, before I go into questions, in this kind of times, we are. And I'm gonna talk a little bit about myself. I feel a little bit, you know, that I have these great tools, but I cannot use it because I've choose to support the government's idea about shutting everything down. As a medical doctor, I'm still waiting for this special suit that is going to cover all of my body and my face and everything. So as soon as I have that, I will be able to go back into my patients and help even some patients with that. So at this time, we have to understand that we are not into the front line, into countries as Europe. Of course, if we would be in East Asian medicine, East Asia, like China, it would have been different. But even in that case, we would be under the conventional medicine support. Why? Because they have more sophisticated ways of understanding how it spreads, etc. So it is very important to understand our limitations, but also to understand why we are very, very, very important. So what it has happened in China, I think I've talked about that before, is that all the East Asian medicine doctors, they were trained into, how they should be wearing these suits, how the measures of self-protections, etc. About the virus. These are things that we don't know that much in East Asian medicine. So they were trained and they were sent into the front line to um, to help, and they have done an excellent work in China. And this is why Chinese, they are exporting their expertise into countries as Serbia and Italy. I don't know which other countries. I've asked one of your tutors, which is Philip Manja, to join us today for some reason. I don't know, probably he was not able.
No, he's here.
Oh, he's here?
Yes.
Oh, okay. I've asked him to interrupt me and to comment. So he hasn't done, okay. So, okay, I'm going to stop sharing. Exit. I'm going to put this grid.
The stop sharing is at the top.
No, it's okay. I can still share because we're going to have a conversation. It's just I want to see what Philip is. So we do have people. We do have Chinese experts trying to help other countries. But also from what Philip told me is that we're not able to handle this kind of knowledge because our medical directors and all the medical personnel, they don't know about Chinese medicine. So it is us that we have to play this kind of role. It's we that we have to play this role, but we don't have the framework yet. That's very unfortunate. I hope in the future it will change. For now, we just have to just do whatever we can for ourselves and for our family and for our friends and help as we can, knowing our limitations. What is very important is to understand that what happened in China and what is happening with East Asian medicine is monitored in scientific way, and it is proven with scientific way. So we're not just babbling around. There are facts, and if you see into my notes at the end, I have few. I don't have all the research, but there is a lot of research going on, and this research is mainly related to immunity. So if you want to communicate what you do with conventional medicine, what you have to say, you don't have to talk about VHC or Gen-C or whatever Chinese you know, yeah? You have to talk into the conventional medicine language, which is basically immunity. So what we can do, first of all, increase immunity. This is proven that points, as I said before, juice and Lee, the moxibustion, or even some herbs, they increase immunity. So if you're not sick, you should do East Asian medicine because you will increase your immunity. Thus, you will not get the virus, or even if you get it, you will not be ill out of it. Second, if you are sick out of it, if you increase your immunity, your body will be able to handle with it. Yeah. Third, if your immunity is overacting, this is the magic with the East Asian medicine, you will help your immunity to regulate itself. Yeah. So as I said before, we have this flood of cytokines after 1 week, this inflammation going on in the lungs. So in that stage, we need to regulate immunity. And this is the double effect of our acupuncture. This is not happening, of course, it is happening with herbs as well, but herbs are much more specific, so they don't have that much a double. Either you can increase or decrease in a way. But what you can do with herbs is you can work on specific symptoms, and we can work together with conventional medicine because we can help the symptoms, and because of, first of all, we don't have an exact treatment for this virus. Third, and last, we can help people from recuperate, getting back into their feet again, strengthening their body, increasing their immunity. So I would say the magic word for us to communicate what we're doing is immunity, either increasing, regulating, stabilizing, whatever. And we do have researches about that for different stages, either with herbs or with acupuncture or with whatever. So you need to have a look at those researches and to be aware of it. There was one more thing, but I think I'm going to wrap it up slowly. I want some feedback from Philip and Benjamin, and then questions.
Okay. Hey, hello. Can you all hear me?
Hi, Philip.
Hey, guys. So
Hello.
really, really good to meet you, to see you, some of you, and some of you I've seen before. So hi to all of you.
Philip, can we see you?
Well, I think even if I turn on the camera, it's so dark in my room that you cannot really see me. I don't really have much experience with this Zoom, so, and I thought that the comments that I would make would be in a written form, so I'm not really prepared for this. But anyway, if you can hear me, I can share some experiences that we have here. So some time ago, like I guess a week or so ago, maybe 10 days, we got the plane from China, actually a couple of planes with medical equipment and the Chinese experts coming to Serbia to help us deal with the situation. So then, like last week, some of the officials, including our president, they mentioned the use of traditional Chinese medicine, the possibility of using traditional Chinese medicine for the treatments. But then in the last couple of days, I didn't really hear any official announcements about that. So I am working together with a couple of other practitioners from Serbia that understand Chinese medicine, that have some knowledge about herbal medicine. Within Chinese medicine, we are trying to get in touch with the board in the government, and actually we have some communication with them, but right now they are, as you can imagine, they are super busy, and they are mostly concerned about the severe cases, and they're trying to fight it with the mostly, well, Western medicine, of course. And right now, this is not their priority to think about Chinese medicine. But today I sent to Yanis this WFAS document. Maybe you have seen it before, in which they say that in some countries like Italy and Iran, the Chinese sent, along with their experts and the medical equipment, they also sent the formulas, the herbal formulas for the patients to use. So I'm not really sure if they sent any formulas to our government. I'm trying to figure it out, but I will definitely try to bring it up through my connections to make it a possibility, and I will keep you updated how it develops.
Okay, Philip, thank you.
Mm.
Um, have you made any conclusion? I don't know if you were listening from the beginning. As I was saying, I'm a little bit puzzled from
Mhm.
the point of view of etiology and other people. They're following the 4 stages. Other people they're following the 6 stages. Other people saying that it's this kind of hubbing. I have different kind of information.
You know,
What is your opinion about that?
you know how it is with Chinese medicine, that even for the for
Most,
the
most
for the co-
simple.
for the conditions that uh, we we know, uh, there are like discussions
Yeah,
which is the right way.
sure.
So there are different schools, and people, some people did like belong to this like cold school, or some people belong to this warm school, and they have those inclinations. So they will choose. They will rather choose the formulas from like Shanhan Lun, the cold school, or the Bing school will choose another formulas from according to their like doctrine or whatever. Um, so it is even more so confusing with the new disease, new condition. But um, actually, one of the things about Chinese medicine is that even though this is a new situation and a new disease, when I talk to the doctors in China, and I asked them how did you treat this, and they said, "Man, we treated it like everything else. We
Yes.
we don't care if it's new or old. We treat it the same way. We do the pattern differentiation, the
Yes.
syndrome differentiation, and according to the constitution and to the symptoms, we give formulas and whatever we do."
Yes. A comment on that. I think this is the message from Yi Jing, because it says this BNE, like everything. We should turn everything into simple. So this is one of the qualities of this philosophy and of this medicine, that no matter what disease you see, it could be so
Mm,
complicated and whatever. It doesn't really matter. You just stick onto your tools, and you will find a way to treat it. And this is why this medicine is amazing, because there is nothing that cannot be treated. I'm not.
exactly. And
I'm not.
it's a big advantage, and it's a big like relief that you know that you're not facing something like supernatural natural, because it's a new virus,
Yeah.
but it's actually just part of um the history, that there have been like hundreds or thousands of situations like this, so there's nothing so new.
Mhm. And Philip, also a comment, because you've talked about the Wen Yi school and the Sanhalu school.
Mm.
Um, we've seen that, okay, there are those two schools, and then we have also the acupuncture school, right? Which they give different kind of uh, they have this different way viewpoint, because it comes from channels, and they talk about
Mm.
the lung and the spleen. They don't talk that much. They don't go that into that detail about uh, you know pathogens, etiology, etc.
Yeah, right.
Any comment about that?
Well, um, when I again, when I talk to my friends in China, Chinese doctors there, I was a bit surprised. I would expect that they used acupuncture mostly for like non-severe cases. That's what I would expect. and of course they did, but they also told me that they used it for severe cases also, as a support, like to boost the immune system and to make the body be in a better position for when they apply the really aggressive Western Western medicines, right? So they wanted to increase the immunity with acupuncture, and on the other side to decrease the anxiety level for the patient when they apply Western medicines.
Mm. Right.
Yes, so that was to my surprise that they used it in those situations as well. And then I asked, okay, so but did you have to wear all this like all this medical protection, like protective suits, and to look like an astronaut while performing acupuncture? And then they said, well, not really. We had the basic like equipment, but as we know, as we clearly know the way, the pathway of transmitting this disease, we are not so in panic, you know, and we did the treatments even in those conditions.
Of course, we know in some cases they would wear the whole protecting gear.
Yep.
But you know, China is so vast, so I'm sure
Oh
that
yeah, oh yeah. They
I'm
didn't
sure
have
that,
time for sure.
I'm sure that different things happened. People would wear and other people wouldn't wear. I'm sure that everything happened there.
Yep, sure, exactly.
Yeah, I think it is. Yeah, it is very important to see acupuncture being in the front line and really helping people.
Mm.
Yes. Any other comments or news that you want to share from China from people that you know, Philip?
Well, I don't know now. More or less about it. Yeah, we're following. I'm trying to keep up, but in last day or two, I'm a bit tired of it. So I didn't really. I don't really have the freshest news. But in a day or two, I will contact my friends again and see how it goes.
Okay.
But actually now we are more in in this than they, right?
Can I ask something?
Sure, yeah.
Philip, have you seen any coronavirus patient or someone that you know or?
Oh, me?
Yeah.
Well, I also stopped working since like this is like the third week or so. I did some online consultations, but not with coronavirus patients. But today, a friend of mine, uh, he has been hospitalized, and it is suspected that he's carrying this virus because he has the symptoms, but we're waiting for the test results.
Okay.
I gave him some advices, just like Yanni said, like tapping the lung area, both from the front and side and from backwards, from the back. And then, yeah, massaging some acupuncture points. I told him to massage this Kongzui point. I can write it down so that you can find it.
I think it's lung 7 or something.
Yeah, I'm not super.
No,
Yeah, I think it's 7, right?
No, it's not 7.
Is it 7? I'm
The-
not.
No, it's not.
So
Which way is the 7?
Anyway, Kongzhui is here. So it's
so
here.
Kongzu is the name of it, and you can write. You can see the location.
It is lung 6.
Lung 6, right? Thank you.
Great.
That's a
Yeah.
problem with people studied in China. Right?
Exactly. I was about to say that. Yeah.
So emphasizing that point.
Can I ask you something? Can you please demonstrate the patting so people can see the ones that they haven't studied Trina yet?
Yeah, you do your palm. Actually, you can just go ahead and pat. Yeah. I mean, in Twina, of course, we want to make it more scientific, but you don't need to be, just you can just relax your palm and your hand, and you can go ahead and tap. Of course, if you want to be a little bit more sophisticated, you just do it a little bit like this, and you tap. But doesn't really matter. Just tap yourself so that you feel this vibration going inside. It is vibrating. And actually what that vibration is doing is it kind of activating your cells, or Eastern medicine wise, your qi and in your blood is activated. So
Exactly. It's good that you emphasize the vibration aspect of it, because if you just have a dull like hit, like dull, how do you say it, without producing, the point is to produce this vibration, right? Not just to have a
Mac.
slap. Yeah, like that, because the vibration should go to the lung level, right, and to activate them.
Yeah.
So could someone do that for preservation of health during these days? And if so, how much do you think? How much time?
Is it for me? Okay.
Whoever wants to answer.
All right. So I remember when I learned from Andrew Nugent-Head. He's an American practitioner who spent many years in China learning from many famous Chinese doctors. So one of them, Aetiology, taught him this technique of tapping the lungs, but mostly from the back. As we know anatomically, the lungs are more towards the back, right? So it's very useful to tap it from the back and for a long period of time. Like he told us that his teacher used to tap his patients for like 45 minutes. And as he said, there were some cases when people even could spit out lung tumors after that, after being tapped like continuously for 45 minutes for many times.
Interesting.
What was the name of this doctor you just mentioned?
Aetiology. I will write it
Thank
down.
you.
Yeah, maybe you can write it down, Philip. Yeah, actually, this kind of technique, as I said before, you can see it in China, all over the place. Everybody knows it.
Right.
And usually they follow the meridian pathways, yeah? So the yin channels that go up. So, you can start from here, you can go all the way up and then down to the back. And then you start from the head, tapping down the yang channels, and then the yin up. So you make this kind of cycle. I think if you go into YouTube, you can find it. It's called Paifa. So I'm going to write it.
May I ask a question?
Sure. It's a question.
Yes. I still fail to understand the dangerousness of this virus compared to other coronaviruses. What makes it so dangerous compared to other coronaviruses? Because if we just look at the stats globally, it's at the moment has about 50,000 dead, while other seasonal flu viruses cause up to 600,000 deaths globally per year. What is the particularity? What made it so famous and so considered to be dangerous?
Well, the problem is that it is very easy to get it, and if you have underlying problems that can severely damage your body, and that could cause you being in need of respiratory support. So the problem is that we do not have enough of that.
Mm-hmm.
And so the problem is that it is spreading very rapidly.
Mm-hmm.
um,
Okay.
and is causing that to, especially to the people that they are depleted already. Yes,
Mm-hmm.
the media, they're trying to scare us, and they try to say, you know, yeah, we had a child dying out of that, and we had the 40-year-old that he was a climber or whatever. As I said before, if you see the normal curve, yeah, we will have exceptions, and it is expected. And it's just those guys are just, you know, it's not, they are media people, so they just want to create this kind of fear.
Mm.
The problem is that it is very easy to spread, and it is causing big trouble. So, as I said in my previous lecture, Katerina, this kind of shutting down and you know, putting everybody into his place and trying to have the social distancing, this is not new for East Asian medicine. This has happened in the past, and I'm not talking about the SARS time. um, I think Philip was also there at that time, but I'm talking about centuries ago. So it's not something new. If we have something that contagious, we want to limit its transmission. Other,
Yeah,
other,
yeah. Okay.
other than that, we know that 80% will just have it as a common cold, or as not even that.
But I heard that no matter what we do, in the end, 70% of the population will eventually get it
Yeah,
because
yeah.
it's so contagious.
It's just
Uh,
it's just that, you know, if we have the 20% of of the 70% getting sick at the same time, is just a huge number. We don't have enough doctors and
yes, especially in Greece.
yeah.
Mm.
Yes, but this quarantine at the doesn't it also affect other levels of our being, like our shen and everything?
Oh, definitely. So first of all, it is up to us to kind of balance that. But you know, this was I was talking with my father yesterday, and I was telling him, look, I think nobody is really thinking of how many people they're gonna get diseased or die out of this quarantine. Because okay, maybe we talk and we have ways of, you know,
Mm.
doing our meditation, qigong, yoga, whatever. But I think there are so many people, they have no other options, and
No tools. Yes.
they're just staying at home, overeating, being depressed, and that is going to bring disease. Maybe not today, but maybe in 10 years. Yeah. Plus all of this economic crisis, which probably will come because of that. It will also cause, we know this economic crisis that we had now, especially in Greece, we know that it created people. We were the second um, most long-lived Europeans, and after the crisis, we were near the end. So,
Wow.
so you see, economic crisis, it is
Wow. Wow.
affecting your health.
Mm.
Of course it is.
So,
Um,
so this
yeah.
economic crisis, it will affect also our health. So there are so many things that we're kind of this is how. I'm not saying being a politician is an easy work,
Mm.
especially at this time, but this is a problem with the system. You know, they never thought about this time. You know, so they were thinking like, okay, it's going, so whatever. So they were not prepared. So it's first of all, is a political thing, and maybe we will learn out of it, I hope.
Yes, it's a test to our public health systems, that is for sure. But then again, how long do you think it would be reasonable to continue this quarantine, looking at the curves you were talking about?
Well, thinking East Asian medicine again, we know that climate is playing its role. We know that also from conventional medicine, humidity and temperature is decreasing its spreading. So I think we just need basically to wait a little bit for the weather to change, to become better. That's my understanding, my personal view.
Yes, and they were saying about Africa, oh, it's going to be a mess. And then I'm looking at the countries of Africa, and they have the lowest percentages of transmission. And usually it's tourists that they've been there and they're locked down there,
Yeah.
and the lowest percentages of death. And I
Just
think, in my opinion, but I want to hear your advice as well. It is, first of all, because they have dry climate now and it's quite warm. And secondly, is because of the shen of the people there. And also because the fragile groups there, they die much earlier of other things. They don't have so many there.
Yeah, good points. Ben, you wanted to say something?
Yes. Also, they've just started testing, and in South Africa, which is the most hit country of African countries, kind of growing every day. So there is that to take into account, is that we only know about the number of people that are actually contaminated. Where they suggest that it's up to 4 times, even 10 times more than what the real numbers suggest. But apart from that, I just wanted to add that the incubation period of this coronavirus, what makes it most difficult, is that it's 14 days. So you can go on for 14 days without feeling any symptom. And compared to the normal flu, which is 1 to 2 days, where you get it and it's a pretty quick response of your immune system, where you have a fever or you have a cold and you receive the symptoms, usually you isolate yourself and you go and you don't contaminate that many people. What makes this one so dangerous is that you can go up to 14 days and contaminate a whole bunch of people without even knowing, and then you'll feel the symptoms, and then you would quarantine yourself. So that's one of them. I sent a little video, it's a 6-minute long video, which actually compares the two, which is very interesting. And you actually see the graph of how many people can be contaminated by the flu in comparison to the one with the coronavirus, and it's basically double, practically double. And I think what they're saying also, and you'll see it in the little YouTube video, is that most people, when it comes to common flu, either they get a flu vaccination or an injection, which boosts their immune system, or they've already got an immune system to the particular flu that is or going around during that year. This one, nobody has any kind of immunity, and we're building it. So there is no blockade. So when you got it, you're going to be transmitting to people. See the video and see what you think about it. We can talk about it tomorrow morning.
Thanks, Ben, for this.
Yeah.
Just a comment on South Africa. It's the only African country with so many whites.
I don't think either it doesn't discriminate from race to race.
I think I'm sorry, but I think it does. They're stronger than us.
May I add something?
Yeah, sure, go.
I don't know how reliable that is, but apparently there have been some researches done, and there appears to be a correlation, because some people ask themselves, like, why this disease is making such a massacre in Spain or in Italy, while other countries, well, which you would think like maybe they are, or they have been underdeveloped, not Western world, don't have resources yet. The disease doesn't spread that fast. And apparently, there is a correlation between vaccinations for tuberculosis and immunity developed for, or, well, there is, I'm not a specialist, so I cannot tell you which cells of the immune system are more active after the tuberculosis vaccination, but apparently the people that have received those vaccinations, they were obligatory, I think, for instance, in Poland, and so on, have better immune response. And for instance, Spain, Italy, United States, where this vaccination hasn't been obligatory, you know, the quantities are considerably higher. So it's something interesting. I just read it today. Let's see if, you know, really they can establish such a correlation, but it's, I don't know. I just thought it was interesting to mention.
I heard the same, Paulina. And I also heard that the Italians, there was a study from Norwegian scientists, and the Italians, they are #1 in consumption of antibiotics and compromised immune systems.
Same thing was in Spain. In Spain, you would get like a normal cold. When I arrived there 20 years ago, normal cold, you go to the pharmacy, and the first thing they give you over the counter was antibiotics, without even, you know, prescription from a doctor. So it was amazing.
Yeah. But also in Greece, we take a lot of antibiotics.
Yes. I agree on that. That's a problem we have in Greece as well. The good thing with Greece is I think we've taken these measures quite early, and I think that that's the reason why we don't have so many people contracting it or so many deaths. Any questions about the Chinese medicine aspect? Any comments? Some of you had questions. I think, Paulina, it was you.
Yeah, the points you mentioned for moxibustion, would it be stomach 36? And then was it spleen 6 and intestine 4? Did I understand correctly?
I'm going to repeat once again. So for moxibustion is stomach 36, pericardium 6, large intestine 4, REN 6, REN 4, spleen 6. Yeah, that's it.
Okay.
Correct.
Thank you.
Okay.
Yanni, how do you see the continuation of classes in our course?
Well, I think the only problem now is with the clinical practice. We will probably have to transfer some of that into the next year. Other than that, I think, you know, this is a great tool. We can all teach and you know, study from the convenience of our home. So I think it's a good thing to use. So I don't think it is affecting us at all. The only thing is the clinical practice, and you know, part of it we're going to do it next year, so it's going to be fine.
Can we do clinical practice in other parts of the world?
Sure, if it's from somebody that is that he's inside an association and he's a legitimate therapist, practitioner, yes.
The thing is now that in the most of the countries they have quarantine. I don't know in which place you can go to do clinical practice, apart from China, of course.
Yeah. Okay.
Something.
Sure.
At the photos with the tongue of the two people,
Yes.
how could we see? How would we estimate the dampness?
They had this thick coating. which was also because of this damp heat or this damp dryness. You know, it was also kind of dry, if you've seen, yeah, and it also had a little bit of yellow coating. So this is, I think, this is the main thing. It's damp, but it's not only damp. It could come together with heat or dryness, yeah.
Damp heat, let's say.
Damp heat, yeah. Yeah. Okay, if we have no other questions, I think that will be all for today. Thank you all for—
Another one, could I?
Sure, sure.
Ben also wrote on the chat, and I realized that I had also this this question. The floating pulse is at any stage could be floating pulse, or at the first stage could be the floating pulse at the stages?
Mainly it's at the first stage, yeah? Because the pathology, it's on the surface.
Yes, okay.
So the cheese also is in the surface. Usually when it progresses, then the pulse should change.
Okay.
Yeah.
Yeah. Thank you.
I want to thank Philip for joining us today and giving his insight and his thoughts about that, and also his information about Serbia. So thank you, Philip, for coming today. Thank you all for joining.
Sure, thank you all.
And
Thank
Christina,
you.
since you
Thank
are
you.
the goddess, you can go ahead and shut the chat. Bye all.
Tomorrow it's at 9 or 9:30.